Good day. Welcome to the Medical Women International Association Near East and Africa Regional Congress, ABUJA 2021. This presentation is part of a panel discussion. I am Dr. Pupuola Margaret Owoloyi, and I'll be presenting the topic, Workplace Violence Against Female Doctors, a Growing Trend. I'll be doing it following this outline. Violence has become an issue of increasing concern in the workplace over the past 15 years, particularly in Europe, Australia, and North America, more recently in Nigeria. Violence against women, and by extension, female doctors, is one of the oldest global public health issues that is still of great concern. Activism from women organizations over the years have broken the silence on violence against women, therefore bringing it to the front burner for more discussions. Globally, female doctors are at high risk of psychological violence, mostly perpetrated by patients, patient relatives, male colleagues, senior colleagues, and visitors, though many of these cases go unreported. Studies have shown that people who experience psychological violence are 7 times as likely to be victims of physical violence. This makes women, particularly women doctors, prone to physical violence. What exactly is violence against women? According to the United Nations Declaration on the Elimination of Violence Against Women, 1993, violence against women is any act of gender-based violence that results in or is likely to result in physical, sexual, or mental harm or suffering to women, including threats of such acts, coercion, or arbitrary deprivation of liberty, whether occurring in the public or private life. Violence against women has many forms, and it takes place in different spheres. It could be in her private life, where it takes the form of intimate partner violence. It could be in the workplace, it could be in the community, and even in the public space. But the purpose of this presentation will be focusing on workplace violence. There are many definitions of workplace violence. However, according to the World Health Organization, it is the intentional use of power, threatened or actual, against another person or against a group in work-related circumstances that either results in or has a high degree of likelihood of resulting in injury, death, psychological harm, maldevelopment, or deprivation. The National Institute for Occupational Safety and Health also defines workplace violence as any violent act, including physical assault and threats of assault, directed towards persons at work or on duty. It is important for us to understand the new concept of the world of work. The world of work is the draft bill of the proposed convention and recommendation of the International Labour Organization. It is meant to improve on the definition of the workplace. It seeks to expand the working environment from just a confined space, which is limited, thereby increasing the scope of protection available to a worker. Broadly put, the world of work expands the idea of the workplace to encompass all aspects of the working environment, meaning it could even include public spaces when connected to the world of work that encompass informal workers. Work-related violence is said to be the third leading cause of occupational injury fatality in the United States of America. It is also said to be the second leading cause of death for women at work, and it is second only to people or women working in the law enforcement agencies. The actual scope of workplace violence is difficult to capture, since more than 50 to 80% of the acts may go unreported. 75% of the nearly 25,000 workplace assaults reported annually are said to occur in healthcare and social service settings. A 10-year study of rape in the workplace in Washington State found 11% of victims were healthcare workers in hospitals and other care facilities. Of these numbers, nurses are the most targeted, about 86%. Following very closely are doctors, making up 68%. Of this 68%, female doctors take up a whopping 39%. What are the top perceived causes for violence? When they are patient-related, they could be as a result of long waiting periods before being seen or attended to by the doctor. It could be as a result of delay in getting medical attention. It could be as a result of denial of admission, amongst others, like not being carried along in the treatment plan of their relatives. Other perceived causes of violence, particularly when related to colleagues or senior colleagues, could be intimidation, bullying. It could be undermining the female doctor's work just for the mere fact that she is female. This type is said to be prevalent in perceived male-dominated specialties. Why are women not safe at work? It is not far-fetched. It is because it is woven into the fabric of the society. Women have low status at home and in the community. Women are considered subordinate to men as prescribed by most societies. Men have the power and legitimate backing of the law to control women, particularly in developing countries. Data tells us that women underreport violence and harassment at work and even at home. And this is because most of them fear the attached stigmatization. We live under cultural, economic, and political structures that continue to exploit the woman. There are three types of violence that take place in the workplace. They are broadly divided into type 1, type 2, type 3. Where type 1 is usually perpetrated by an unknown assailant, could be a gunman or an armed robber. Type 2 could be perpetrated by a patient whom the doctor is treating. And type 3 may be perpetrated by another employee, could be a senior colleague or an acquaintance of the worker. Violence in the workplace could also be physical. It could be sexual. It could be emotional, like verbal assaults, psychological assaults, could even be economical. These are examples of violence acts that could occur, like direct beating, stabbings, shootings, rapes. All of these lead to psychological traumas. There could be threats or obscene phone calls. There could be intimidation, harassment, and of course, the doctor could be stopped by unknown individuals seeking to do her harm. A number of people are involved in perpetrating these acts. They could be outright strangers, unknown to the doctor. They could be patients or patient relatives. They could be co-workers, senior colleagues, and other acquaintances. What are the risk factors? Risk factors may differ depending on the peculiarity of an institution. Risk factors could be social, they could be political, they could be as a result of the institutional policies that are in place, they could be work-related, they could also be as a result of interpersonal differences. Studies have shown that younger doctors face more physical violence than older doctors. Also, female doctors are more likely to face violence than male doctors. Data available to us show that obstetric and gynecological department reported the highest rates of violence against their doctors, followed closely by Department of Medicine and then surgery. While the emergency unit and psychiatric units are known as hotspots for violence. It could impact greatly on both the doctor, the institution, and even the society at large. On the doctor, it could impact on her career. It could cause stagnation of career progression. It could also lead to outright abandonment of her career. It could affect or impact her finances negatively. It could affect the health institution, giving rise to great economic loss. It may also affect the economic output of the nation at large. It is important to put in place preventive actions against violence against women. This is because it's actually cheaper to prevent violence against women, because studies have shown that economic loss accrued due to violence against women has been estimated to be about 226 billion euros, while economic loss accrued due to preventive activities came down to about 13 billion euros. How do we intervene? It is important to report incidences to appropriate authority and promptly also. This is because the authorities know exactly how to handle such conditions. There are a number of violence prevention actions recommended for the healthcare industry by governmental agencies and violence experts. Such actions could be prevention actions for patient to client violence. Also, prevention actions for co-worker violence. These actions put in place and appropriately monitored will help to curb the culture of violence in workplaces. When there is violence, particularly type 2 or type 3, it is important for the individual or the victim to gain control of the situation by reporting promptly reporting promptly to the appropriate authority. Once this is done, It helps the individual to take action, and also the individual may be at liberty to take legal action if need be against the aggressor. All of this make it difficult to curb violence against women in the society, thereby giving rise to challenges. The challenges seen in most communities are because what constitutes violence or abuse may vary across cultures and individuals. Also, there is the culture of silence, which surrounds workplace violence that can affect reporting. Sensitivity of the topic is also a deterrent to reportage. All of these give rise to the very minimal official statistics that we see, whereas there is a huge impact, or there is a huge problem or culture of violence going on around us. Female doctors most often do not report these acts of violence because of the duty to do no harm, and they usually put their patients first. Also, because of the fear of retaliation, and also the possible fear of stigmatization that may follow such reportage. What then is the way forward? Way forward can be broadly divided into 4: doctors' responsibilities, the institution's responsibilities, the media responsibility, and of course, the government's responsibility. Doctor's responsibility has to do with the fact that the doctor has to know her bounds. Do not treat beyond the scope of one's training and facilities to prevent both violence and litigation against oneself. The doctor is advised to make extra effort to explain the patient's condition to the patient's relatives so as to have a realistic expectation of the treatment outcomes. Also, senior colleagues should desist from bullying or psychological assault. Senior colleagues should also strive to be mentors that build and not those that destroy the confidence of those they train. The media should avoid sensational reportage, while the government should improve health budgets. There are a number of other activities that individuals can do to support the campaign against violence against women. One of those things will be to document women's stories that capture the different forms of violence. Another thing that can be done will be to join the 16 days of activism. What exactly is this 16 days of activism? It is an international campaign against violence against women. It unites organizations and individuals across the world. It takes place usually from the November the 25th to December the 10th each year. This 16-day period includes the following important dates: International Day Against Violence Against Women, World AIDS Day, and the International Human Rights Day. In conclusion, I would like to say that due to the rising rates of violence, doctors, and not necessarily only the females, are increasingly reluctant to take up challenging cases, thereby compromising healthcare delivery. There is therefore an urgent need to make healthcare facilities safe havens for doctors, as only then can they work with complete dedication. These are my references. Thank you for listening, and God bless.